Reasons offered by heart failure patients for non-adherence with prescribed medications. Background. Heart failure affects roughly 23 million people globally, about 5.7 million in the US, and results in over 1 million hospitalizations annually. Estimates show that up to 54% of heart failure readmissions are believed to be preventable. Heart failure patients have one of the highest rates of readmission out of any disease. Tufts Medical Center data shows that up to 23%, almost 1 in 4 of their heart failure patients, are readmitted within 30 days. Research indicates that medication discontinuance rates vary depending upon the type of heart medication, suggesting that patients with heart failure may have differing reasons for discontinuing their medications. Medication barriers in chronic disease. Negative beliefs are more significantly associated with medication non-adherence rather than external barriers. Negative beliefs may include fear of side effects, complex regimen, lack of information. External barriers may include an inability to pay or lack of transportation. Other negative beliefs may include a mistrust of the healthcare system or a belief that the medication is not beneficial to them. Medication barriers in heart failure. The heart failure population often has a complex medication regimen related to the disease process. Other comorbidities such as diabetes, hypertension, hyperlipidemia, and obesity complicate the pharmaceutical management. This combination of complex medication regimens and multiple comorbidities creates a unique set of barriers to medication adherence for individuals with heart failure. The main explanations for medication non-adherence were poor or complex medication instructions, running out of medications, and adverse drug reactions. Our aim is to identify the reasons patients with heart failure do not adhere to medication instructions to inform appropriate interventions to increase medication adherence in the future. Our methods. A screening survey was distributed to identify participants with heart failure who altered their prescribed medication regimen or were unclear in their heart failure instructions. Qualitative interviews were conducted to discuss medication participation, what factors influenced their decision to take, alter, or skip their medication, and what type of education was received from a healthcare provider. Participants were asked to discuss their level of understanding regarding their medication instructions and their management plan. We identified 3 barriers and 2 facilitators in our findings. Barriers mean that they decrease the incidence of medication adherence, and facilitators increased the incidence of medication adherence. Our barriers included forgetfulness, poor coordination between providers, and low levels of understanding related to heart failure, medication, and diet information. Many patients responded that they simply forgot to take their meds at a certain time or they simply forgot to take them at all. Poor coordination between providers resulted in confusion among patients, which increased their mistrust and also increased the complexity of their medication regimen. Low levels of understanding in heart failure meant that patients often did not understand what heart failure was, its complications, or its proper management. Low levels of understanding in regards to medication meant that they did not understand why the certain medication was prescribed, its side effects, or its correct usage. In regards to diet, patients reported that they did not follow a diet because they did not know why they were on a diet. They also reported that they simply did not know which foods to include in the diet because they did not seek any follow-up appointments with a nutritionist or dietitian. Our facilitators included organization using a weekly pill container and the use of an online platform or patient portal to simplify communication between patients and multiple providers. The pill organizer helped patients ensure that medication was taken at the proper time and also helped to reduce forgetfulness. The online care platform allowed patients easier access to their providers so that they could ask clarifying questions and helped keep multiple providers on the same page regarding the overall plan of care. Practice implications. Offering educational material to take home and ensuring educational topics are reviewed and follow-up appointments are necessary starting interventions. Encouraging patients to ask questions, especially as some participants expressed anxiety directing their questions towards their physicians. Some strategies for this include writing questions down or using a surrogate, such as a nurse or family member. Prior to discharge, nurses should evaluate the patient's understanding of their healthcare instructions and address any misconceptions or gaps in knowledge identified. Conclusions. Identifying common facilitators and barriers to medication adherence among patients with heart failure can help construct interventions to increase medication engagement. Barriers found in this study included forgetfulness, poor disease, diet, or medication understanding, and poor interprofessional communication between providers. 2 facilitators identified were pill organizers and interprofessional online care platforms. To maximize medication adherence, nurses should focus on advocating for repeated patient education, health literacy, appropriate communication methods, and the development of strategies that assist with managing medication schedules.